Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
Today on our Partner Spotlight, we have Kayla Morris from St. Peter's Health here to talk to us about her FUSE program. Welcome, Kayla.
Thanks, Emily.
Can you tell us a little bit more about your project and what problem you were trying to solve?
Absolutely. So the FUSE program is a part of our Housing as Healthcare project, and FUSE stands for Frequent Users of System Engagement. So these are individuals who are unhoused or unstably housed and have frequent utilization patterns of the emergency room and other emergency services such as the police department and mobile crisis response team. And so we know that many people who are unsheltered often have significant health concerns and chronic diseases, which then limit their ability to work and gain housing. We also know that chronic disease outcomes are significantly shaped by social determinants of health and unmet needs. And so due to many barriers that people who are unsheltered often have with seeking health care, they often seek this health care in the emergency room. But we also know that you can't adequately address chronic diseases in the emergency room. And the goal is to get people the right care at the right place. And so if we have more stable housing and we get people connected to the right services, that will allow them to more proactively and continuously address their chronic conditions. And we will also be rerouting inappropriate utilization from the emergency room back to primary care in order to help stabilize their chronic conditions. And so through this program, we have 2 community health workers, and they work in a non-clinical way to help out with their clients. So they help monitor and follow up on their chronic disease management. And community health workers are often their accountability partners and liaisons back to the primary care team. And so it's really difficult to even think about your health when you are unhoused, and our community health workers help them out with this aspect. They also help them apply for housing and get involved with any other services that they need.
That sounds like a great program. Can you talk to us a little bit more about what your goals were when you started the program?
Absolutely. So some of our goals were to increase housing and retention rates, decrease inappropriate utilization of the emergency room and other crisis systems, increase utilization of primary care, increase chronic disease management, and advocating for appropriate care of the FUSE clients.
That's great. What have some of your results been so far?
Yeah, so far we are about 9 months into our pilot program, and we're seeing really great results. Of those, we're seeing an overall 55% reduction in healthcare utilization, which includes mobile crisis response team, ambulance, emergency room, inpatient medical admissions, behavioral health unit admissions, and urgent care visits. And we're also seeing an overall 82% reduction in justice system utilization, including Helena Police Department calls for services, Lewis and Clark County Detention Center bookings, and how many days were spent incarcerated at Lewis and Clark County Detention Center. We're seeing that individuals' healthcare is improving and stabilized. We're seeing more connection to primary care. We're seeing that people have the appropriate access to their medications and are taking those as appropriate. We've been able to get 15 people housed, and we've really been able to address many needs that were barriers to housing due to people's health conditions. So we're seeing really great results thus far.
Those are pretty impressive numbers.
Yeah, we're really excited about them. It shocks me every time I look at them, even though national data for these programs mirror our results. So it shouldn't be a surprise, but it's always still surprising.
Well, you should be proud of the work you're doing. That's great.
Thank you.
What advice would you have for others that maybe want to start a similar program in their organization?
Yeah, absolutely. So as a health partner getting involved in housing work, these projects happen all over the country, and so a good first step would be looking up housing as healthcare projects and FUSE programs. It's really important that you collaborate with your local continuum of care partners and other nonprofits who service this population. We really couldn't do our work without them. They help us in so many ways, from data to being introduced to the individuals, and our community health workers and Good Samaritan Ministry Street Outreach team work very closely together to get these successful results. It's really important to know that results aren't linear. Oftentimes it feels like you're pushing a boulder up the hill, and sometimes that boulder is going to roll back on you, but you just have to keep going with it. It's super important to know that community health workers need really strong leadership, and they also need small caseloads. So that's something that leaders often have to advocate for. But if our community health workers have too many patients, due to how much support that they provide each individual, they wouldn't be able to adequately support individuals, and therefore you're not going to see the results that you want to see. And finally, I guess my biggest piece of advice is that community health workers really are the key to this work. Community health workers often have lived experience in whatever their target market is. And so that lived experience helps them connect with their clients at a deeper level and really effectively help them. Another important part about the community health workers is that they are able to meet patients where they're at. So they meet them on the street corner, they meet them at their campers, they meet them at different nonprofits out in the community. And this is key to really successfully helping with these individuals. We often joke with our team that if we see our community health workers in their office in the clinic too much, they're not doing their job well enough. And so that's not to say that we don't like our community health workers and seeing them around, but really the best place for them to effectively make changes out in the community.
That makes good sense. Well, thanks so much for being here today and sharing your program and your successes and advice. I hope this helps our other partners, and have a great day.
Absolutely. Thanks, Emily.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.